Hello, good morning, good afternoon, good evening. I would like to thank the organizer for the invitation to join this closing panel. I really regret that I can't be with you today in person, but I'm so glad that I can share my presentation as a pre-record. I'll be providing the brief overview of the World Health Organization perspective of implementing mitigation strategy to protect hard-wins gains in HIV, tuberculosis, and HCV responses. This is status of COVID-19 pandemic of 7th September. Globally, there are nearly 27 million cases of COVID-19 and 880,000 deaths. The pandemic is being driven by the transmission in the Americas, Asia, especially in particular in India, and from the resurgence in Europe. From the epidemics, sir, it is clear that the COVID-19 will be with us for many more months to come. And that is so important we understand how best to mitigate its impact on the essential health services of HIV, tuberculosis, hepatitis, and other very important comorbidities conditions. At WHO and around the globe, many groups has modeled the impact of service disruption on the future outcomes of HIV, tuberculosis, hepatitis, malaria, and other diseases. And the outcomes are clear, with interruptions in the supply chain of ARVs and reduced test diagnosis and treatment of HIV, hepatitis, tuberculosis. The deaths will increase in 2020 and could draw back many years of health gains to the levels of deaths and new infections since more than 10 years ago. We have to act to safeguard our investments to ensure the healthy lives for all. To protect these public health gains, World Health Organization has fully developed a comprehensive guidance of the COVID-19 response to address the dilemma of balancing the needs and demands of COVID-19's response versus strategic planning to ensure that the most essential life-saving health services continue. The guidance from the World Health Organization outlines the basic principles and practical recommendations that support decision-making to ensure that the continuity of essential selected services for health, outlining the key actions that the countries should consider. The WHO documents focus on the disease-specific areas of working, including HIV, hepatitis, and tuberculosis. These recommendations do not replace the comprehensive program's guidance, but highlight the areas of programs that needs to be implemented, and others can be put on the pause and restarted when delivery can be done safely. In particular, all the activities described below should be implemented in a way that is fully consistent with up-to-date WHO guidance on IPC. In general, when the program's activity is not mentioned and can be delivered safely, it should be continued in accordance with existing guidance. From the WHO side survey on the services disruption across 91 countries, the major challenges reported was related to the decrease in the volume of the clients attending to the health sectors and likewise the deployment of many of the frontline health staff to work on COVID-19. Fear and the lack of PPE among health and community health workers also may be an issue. And this survey has looked for innovative approaches to mitigate these effects, such as using telemedicine, task shifting, improved and local PSM and community support and community-based service delivery. Already, more than half of this survey countries are using these approaches, which is great to deliver care. Lastly, across the board, we must remember that mental health as a baseline need for all clients to maintain critical health services. For this year's Mental Health Day, on the 10th of October, WHO, together with our partners organization, is calling for a massive scale up in investment in mental health to make sure that all the people can have access to mental health services during this time of COVID-19. To wrap up, I would like to remind you that the World Health Organization is working to rapidly and actively scale up the response to the COVID-19 through the ACT Accelerator and the COVAX. These investments bring many partners together to prioritize access to vaccine, therapeutics, diagnosis, while strengthening the health systems to deliver these tools. WHO, like many organizations, are boosting our efforts in the countries to support those most in need. With this, I thank you and wish you an excellent panel discussion.